Good morning, everyone. This is Andy Reese. Sorry I had some technical difficulties getting started this morning. Seems to be an issue across the district government this morning, having some difficulty with technology. Let me start by sharing my screen and sharing our current data. So as you can see, just as a week ago, our total people diagnosed with COVID to date is 409, 11 people in February. Fortunately, since last week, no additional people. And by placement type, there have been 6 in host homes, 114 in intermediate care facilities, or ICFs, 1 in a mental health facility, 49 people in natural homes, 2 people in a nursing home, 4 in out-of-state placements, 37 in residential habilitation, and 196 in supported living. So the outcomes by placement type have been within intermediate care facilities of the 114 people, represent about 38% of people in ICFs who have been diagnosed with COVID. Of the people who've contracted COVID in ICFs, 20 have since died, representing 17.5%. However, only 12 of those are confirmed as COVID deaths, so that's about 10.5%. In natural homes, we have had 49 people test positive out of approximately 930, accounting for 5.26% of the people in natural homes, where there have been 5 deaths. All were confirmed as COVID-related, representing about 10.2%. Within residential habilitation, the 37 people who've contracted COVID account for about 33.6% of the population in residential habilitation. Of those 37, 3 have died, only 2 were confirmed as COVID. So overall, the accounting for a death rate amongst people in res hab of 5.4%. In supported living, 196 people out of also approximately 930 have contracted COVID, accounting for 21% of people in supported living. Of those, we've had 18 deaths, 14 of which are confirmed as COVID, reflecting a 9.1 or 7.1% death rate for those folks. Overall, we have had, as I said, 409 people contract COVID. I updated these slides, and then when my computer crashed, the numbers I hadn't saved. So this number's off by a little bit because we've in fact now had 50 deaths of people, and the percentage overall is a little over 12%. But the confirmed COVID deaths is the same, which is 35, accounting for about 8.5%. So as you can see, in February, we had 3 people in ICFs, 3 people in residential habilitation, 4 in supported living, and 1 in a natural home who tested positive for COVID. And of the people who tested positive in February, there were 11. 1 has required inpatient care. We currently do only have 1 person in the hospital getting COVID-related treatment. So in terms of the people who've been diagnosed with COVID who have died, 50 people who've been diagnosed have died. 7 of those 50 were confirmed as not COVID related. We are still awaiting the confirmation from OCME about the cause of death for 8 people. In February, we've had 4 people die, and 2 of those were confirmed or presumed COVID deaths, as they were people who had gone into the hospital and died from COVID-related complications. The other 2 had COVID some time ago. And among our provider staff, 649 have tested positive for COVID. 48 of these staff work for more than one provider, and 10 staff have died from COVID. So as people are aware from last week's hearing, actually either from the hearing or from the mayor's press conference last Thursday, Group 1C for in the vaccination phases is now rolling out, and that includes people with underlying health conditions, which have been defined to include people with intellectual or developmental disabilities. And so we are starting to work on, we have been coordinating with DC Health on this, and we have 2 days that we are scheduling people for right now, and we're working with them on the possibility of scheduling additional days as well. What we've been doing is having our nurse coordinators here reach out to the provider nurses to identify sort of the highest priority people for getting their vaccine as soon as possible. Each day they can accommodate 168 people. As people should be aware, people 65 and older have been able to get their vaccine since January 11th, and we have a number of folks who have proceeded with that. We did have our event, and we have had our second day of vaccine for everyone who got their first vaccine in intermediate care facilities and residential habilitation. And we're still working on the folks who didn't get it then, making sure that some people didn't get it because they were sick. You know, if people didn't get it for a reason that they still need to get it, we're following up on that. And then following up on people who are in their own homes or supported living, to identify those that could participate in the next clinic that's being coordinated with DC Health. I also just want to remind people, there are other avenues for getting a vaccine. Some of our folks live in Maryland, and you should be exploring what the options are for people who live in Maryland. There is the website in DC, and I do highly recommend. It says there you can, when you log in to coronavirus.dc.gov/vaccinate-DC, you can register to get updates if you can receive texts, and you can get regular updates from DC Health about when new vaccine is being released. And I can tell you lately, I think I've been getting updates at least once a day. So I really recommend that people go in and register for the update. The first vaccine event that our nurses have been calling around about recently is on March 9th and March 10th. So I had some questions up. I'm still having some difficulty with my technology here. I'm going to see if I can open those questions up again. I think essentially the questions, not surprisingly, were all about vaccine. And so what I will say is that as we have information from DC Health, for example, when they provided the information about the availability of vaccine next week for people with intellectual and developmental disabilities. We have pushed that out to all of our providers, and our service coordinators have reached out via telephone with all of the people who receive just service coordination and are not connected to a provider. So we've made sure that people are aware of where things stand with vaccine, trying to, check in to see what kind of help people might need, but just letting them know what is available there. We are working on making some changes to MCIS that should be available soon so that we can track well where things stand with people in terms of vaccine. Providers, of course, have documentation of medical care that someone's received, including a vaccine they've received, but we're going to have a place on MCIS where that tab will be dedicated to this so that they can upload the data, and then we can get reports and have an overall good picture of exactly where we stand so that we're clear about the resources we need. And as soon as that's available and been tested, we'll then be sending something out to provide instruction to providers about how to upload the information there. I now have access so I can see what the exact questions are. So the vaccination events that we'll be having, there's a question about, do we know where they're occurring? Yes, they're happening at the same Kenilworth Recreation Center where the last one happened, which in terms of size was very good, just in terms of, as I had said, when that event occurred, I was able to visit there while the event was ongoing, and it was set up in such a way that it could provide a safe venue for people so that the traffic moved smoothly through the event, where people could come in, get registered, have a safe place to sit and wait, then go see the person who gave them the vaccine, then go over and have a safe place to sit after the vaccine so that they could be observed to make sure there were no adverse reactions to it, and then move on and then bring new people in. And it was a large enough venue to accommodate all of that in a very safe manner. So the questions that we received were the plan for, I guess, what is the plan for informing all people receiving DDS services about their eligibility for the vaccine, and subsequently the plan for enabling people to get the vaccine? So as I said, we have these events. People can register as anyone else in the district who is now eligible. So people who were over 65 could attempt to register. People who are 16 to 64 now who have underlying health conditions can attempt to register. And, as more vaccine becomes available, it will be it won't be as challenging to get through the website. I know the website had some challenges this morning, but I also know that they ultimately filled up all their appointments. So as challenging as it was, clearly there's more demand than there is supply. We're concerned that if people are left to fend for themselves in terms of registration, that many people who become eligible March 1st, who are savvy with technology and such, will end up crowding out DDA folks with significant conditions that put them at high risk. I will say, as someone who, I mean, I guess I had some trouble navigating, so maybe I can't say I'm savvy with technology. Um, the website had some challenges this morning. So, even for everyone attempting to do it, it was challenging. I will also say that in the district, so there are 3 days right now that they're allowing this expanded group to register for vaccine: Thursday, today, and tomorrow. And 2 of those 3 days are for people in zip codes where there's been higher incidence of COVID. And so there is that effort in the district to make more accessibility for people who've been affected more by COVID, in addition to reserving spaces where, where DC Health is working with DDA for the people we support to have these separate events. But as I say, people shouldn't rely just on these separate events. To the extent they're able to attempt to register themselves, they should do so. The other thing, when you go to the website, you will see is if you're connected to any of the hospitals in the district, you can log into their website. And connected to means you've been there in the last year for any care. And so you can log into their website and get on their waiting list for when they have vaccine available. And they will also, each of them handles it differently. I know some of them take your information and will text as soon as they have vaccine available. So that's another avenue that people should be trying. Is it your understanding that all people who receive DDA services are eligible for the vaccine? Yes. The questionnaire that you have to walk through on the website asks if you have any of a list of underlying conditions, and included on that list is intellectual or developmental disability. So that would be everyone supported by DDA. What are the efforts to get the word out to the broader DD community of people who are not receiving services? That would be just the same as the public information that's being provided to everyone. I don't know of a DD specific communication strategy. There's, just district wide, all of the different things that are being done to connect with people. So the DD Council, I assume, is saying that they'd be happy to partner with anyone who's already working to distribute information. And perhaps you could reach out to DC Health and let them know that you could do some outreach, in addition to whatever they're doing. EPD waiver, the elderly and persons with disability waiver eligibility. The challenge with this is, so elderly, I think in the EPD waiver it's 65, although I believe it is. And so those folks have been eligible since January 11th. And then people with disabilities in the waiver may or may not have a disability that's listed. They might not have an underlying condition listed. So we have not coordinated with folks around the EPD waiver, quite frankly. We are doing our very best to keep up with helping the folks that we support at DDA get the vaccine that they need and keeping them safe and healthy. So at this time, that's sort of the extent of our bandwidth here. The target population for the vaccine event on March 9th and 10th. So for the one on March 9th and 10th, we were looking first at the people who were previously eligible who hadn't yet gotten a vaccine. So that would have included people in ICF, residential habilitation, and 65 and older. And then after that, speaking with the director of nursing in the various provider agencies in order to identify sort of the highest risk people and come up with the list. Because as I said, it's 168 per day for those 2 days. We are hoping for additional events in March, and all of that is sort of conditioned on the amount of vaccine that comes into the district. But DC Health, and I see Karen's with us today, Karen Stringfield from DC Health, who's been a strong advocate for our folks in making sure that, I don't believe reminders are necessary because DC Health does recognize the need of our folks, but Karen is there specifically to make sure that the needs of our folks are kept in mind as they do their planning for the rollout. So it's really based on sort of the medical assessment of the highest need. And then beyond that, I'll say this many times today, people should still keep trying. Registering is a multi-step process, even if the website were working properly. What supports are being provided to people to help them register? So we've actually had quite a few folks who have been eligible since January 11th because they're over 65 and their provider staff has helped them and they have been able to navigate that and get their vaccine. Are goggles and face shields to be worn at all times in supported living placements, or should they just be worn when care is given?
Hi, Director
I think
Reese.
we have. Good. There you are. Hello.
Hi, how are you? This is Daryl Hawkins. And what I will say is that the supported living, the CRF and supported living document guidance from our coronavirus.dce.gov website says that staff must wear eye protection in care areas. And we define care areas in our other document where resident care is rendered or person-supported care is rendered, where any procedures are performed, and anywhere there is potential for person-supported or patient encounters. So essentially, if you're in the living room and person-supported can enter that living room, you must be wearing eye protection. However, I know some homes have a basement that is only restricted and can only be accessed by staff. That is not considered a patient care area. However, you should be wearing eye protection even in that staff area if you cannot maintain 6 feet away from other staff. So that is our guidance for eye protection and when you are to wear it. Thanks.
So this next one, I'm not sure who our vaccine expert is in terms of the medical issues related to vaccine, but I'm sure there's someone who will jump up here. One resident got his first vaccine, but unfortunately had an exposure, so was quarantined and missed the second vaccine. And they're saying they were getting Moderna. So how is that handled?
Hey, Director Reese, it's Karen. Hi, everybody. So this is I don't want to say it's a common problem, but it is a problem that has come up in several other occasions. And if that person is quarantined, they should carry out their full quarantine period. Usually what happens is if the appointment was made through the portal and the second appointment was subsequently missed, then there can be an email that's sent to vaccinatedc@dc.gov. However, if that person received their first dose at one of our at the clinic that was held at Kenilworth Rec Center, then that will be, I believe that it will be taken care of in the March 9th and 10th events. So as long as the quarantine is over, and it should be, well, as long as the quarantine is over at that period. Other than that, we can try to work something else out because even though it is a problem that has come up before, I'm sure there aren't, a million people that have this issue. So we can work out some other deal with that if the 9th and 10th are not conducive to the quarantine.
Karen, I just want to follow up with that. So if anyone's having that issue, please reach out to me. This is Kirk Dobson in Quapma. Please make sure to send me an email because we are scheduling those folks who didn't miss their second doses. Thank you.
So someone else received their second dose, but the card that they received, but a card that he received, but I guess the card said it was the first dose. How do we get a record of the first vaccine and fix this? So if someone has unclear documentation of their vaccine, but they received it, and I'm assuming this is someone who got the vaccine at Kenilworth, if the person who asked the question could respond to that, because I mean, I would say go back to whoever gave the vaccine. But if you got it at Kenilworth, do we have an answer to that, Karen?
I guess I would need more information of what exactly is needed. I don't necessarily.
It sounds like they
understand.
don't have documentation that they got both doses, but they did.
Oh, and the 3x5 card is written for just the second dose? Is that
Right.
how it's being
That's what it
written?
sounds like.
I actually don't have an answer for this. I can reach out to our team and see if I can get that information, but I haven't come across this problem before, so I would have to try to research that and get back to you.
And maybe if the provider could scan the document that they do have and email it to Kirk, then in his coordination with Karen, they could clarify how to correct this.
Absolutely, that'll be very helpful.
So it's Kirk dot Dobson, DOBSON at dc.gov. So I understand this. The vaccination event on March 9th and 10th are limited to 168 per day, and it will be for dose 1. And they will first take the leftover people from ICF and ResHab and 65 plus, and then triage to all people with IDD. Is that right? And who specifically is coordinating this, since it's 7 working days away? So a couple of things. Yes, it's for dose 1, except those random people who still need a dose 2 because they just missed their dose 2 recently. And yes, that is correct, that it is for people where the highest priority is to finish up the people who were the higher priority, which is, 1B, the folks who were in ICFs and ResHabs, or the people who were 65 and older. And then moving on. And so our nurse supervisors are coordinating with the directors of nursing along with Kirk and Karen. And I think that's clear enough about the coordination. But if there's any clarity that anyone else who's a panelist wants to provide, please do.
I just wanted to clarify also, I think Ian's question may be going back to whether we'll be reaching out to providers to set appointments. That will not be happening this time. We will be doing the appointments through the directors of nursing and our nursing team. So providers have already been contacted. So there will be no further provider responsibilities for registering folks for these vaccines. Thanks, Director Reese.
I'm not sure if this is an agency-wide issue, but we've experienced unusually long delays with the benefits unit. I don't know what the benefits unit is. If you could clarify, and I see that Jared's here. I don't know what kind. So if maybe
I'm here,
Jared, if
Andy.
you could just review for people sort of if they're talking about support for Medicaid SSI, if something is challenging, sort of up the chain, who they should speak with.
Sure. Thanks, Director Reese. What I will do is provide in the chat 2 email addresses so that if there are questions and the delays that you have experienced, if you could email both of these addresses and we'll look to address them.
A concern we had in the residential meeting was eligibility letters are not being loaded into MCIS and they're needed for housing. Is this a new concern? I mean, was this always done? Amy, if you could just let me know, is this a change that eligibility letters are not being loaded into MCIS, or is it now apparent that something that's not been done consistently before is definitely a problem?
Director Reese,
Yeah.
would you like me to unmute Amy to have the conversation?
No, she's just said, thank you. So Jared, do you know anything about that?
I don't, but Amy, I'll give you a call today. It's the first I've heard of it, so I'll give you a call.
Any Appendix K updates? Unfortunately, I don't think so. It is with DHCF for final approval. So as soon as, so DHCF will then submit it to CMS. I'm sorry, Department of Healthcare Finance will submit it to the Centers for Medicare and Medicaid Services for approval. Will the vaccine be given at residential habilitation homes, or will they go out to get them? Just thinking about those who are medically non-compliant. So at this time, the resources we have are to go out, are for people to go to a specific location to get a vaccine. We are working on the issue for people who need someone to come to them. My hesitancy there is someone who's non-compliant. The idea of going to people's homes is about going to people who are unable to travel. There'd have to be a discussion if you're talking about a person who is non-compliant about the idea that you're going to have someone go to them and give it to them. It is um, a voluntary vaccine. And so it just caused a little concern when I read it that way. But we are exploring, because I do recognize that there are people in all different kinds of settings. There are some people who are going to need someone to come to their home to provide the vaccine, and we are working on that. Where can I find the new billing rates for services for this year? I don't know that there's been a change this year. There were new billing rates that would have been published with the new waiver in November, and the rates haven't changed since then. As people may be aware, typically the rate goes up in January because the living wage goes up in January. This year, the living wage went up on July 1, and it will be assessed to determine whether there's an increase again July 1, 2021. And so there was no change of rates as there typically is on January 1st. Seems like a fairly quiet day. Has been a fairly quiet week. As I mentioned at the beginning, we had our first week with no new COVID infections. It's the first week in a while anyway. We also had a day this week with no new staph infections. So, that's some very good news. So if there aren't other questions, we can end on the very good news. The vaccine is available slowly. As you are able, please make every effort to either coordinate with us or make your own efforts to register. Register in more than one place so that you can get it as soon as possible and get vaccinated. And do remember that at this time, vaccination is just one extra layer of protection that we need to continue doing all the things that we have been doing to keep us safe, including, wearing masks, keeping social distance, washing hands regularly, all those things that I hope have become just habit by now. So please, oh, so it appears that someone entered a question. Just as a reminder, if you're going to enter a question in the chat, you have to scroll down to everyone and type it in there, because otherwise, when you first open it up, it often opens up immediately to attendees. And so then you'll be asking the question of all of the other people who are listening and not the people who are able to speak and provide an answer. Are we still expected to internally track our staff and persons served for vaccinations? Are we to report this to DDS? If so, when? I'm going to say yes, and then turn to Kirk to give to get specifics.
Good afternoon, everyone. So please continue to track internally your staff vaccination rates. We have developed profiles for each provider, and so your QRSs in the upcoming weeks will share those profiles with you, and you'll be able to update those profiles in real time via online portal, and we'll be able to kind of keep it up to date that way, instead of having you fill out that form all the time, because it's a very lengthy process. So the data has been collected, as I said, and it's in these profiles. And in the next 2 weeks, your QRS will share that with you. The goal is to really do this bi-weekly or monthly, just depending on how easy it is to get the data back. But it really should be a quick conversation between you and your QRS and your frequent check-ins. So please stay tuned for that. Thank you.
And it's really helpful information, because I will say, from a preliminary review of it, we see significantly different outcomes by providers. And I think that as we can identify some providers where there's been more success with their staff getting vaccinated, it would be very helpful to then ask them to share the strategies they used for their staff to get vaccinated, so that the providers who seem to be having more challenges with this can learn from them. So it's 12:55 and we don't seem to have other questions. We'll go with that. As I said, it seems to have been a very good week. Not only do we see the reduction in our new infections, but some hope on the horizon with vaccine becoming available. As I said, I encourage everyone, please continue to do everything you need to stay safe. And as you're able, navigate these different systems to get your vaccine. So I will talk with everyone next week. Thank you very much.